All right. I want to welcome Kelly and David to our World AIDS Day. We're going to interview them for a little bit. And so thank you everyone for joining us. My name is Jenna Altstadt. I'm on the Nashville Cares Development Team. I'm the Community Engagement and Volunteer Manager there. And I'm going to give it over to Kelly and David to introduce themselves.
You go first.
Okay. My name's Dave Aronoff. I'm the director of the Division of Infectious Diseases at Vanderbilt University Medical Center.
And I'm Kelly Hill. I am the partner of David Aronoff, and I work as a early childhood educator as well as volunteering at Nashville Cares.
Well, thank you so much for joining us virtually. Really appreciate it. Appreciate having you involved in general, but also right now for chatting with us. So I have a few questions. We're going to kind of get an insight on, why you are involved with Nashville Cares. So my first question is just, how did you two both become involved with Nashville Cares in the first place?
Well, being married to an infectious disease physician, I have been kind of steeped in his work. We were married during medical school and residency. And so I also came from a background of working in the community with HIV in college. So it was a natural segue when we married to continue on with that in my life. So pretty much all the places where we've lived, I've tried to become active within the community wherever we are.
And then, again, being in infectious diseases, there really hasn't been a bigger challenge than HIV over time. I mean, my entire career has had HIV in the focal point as a major global health crisis. We've been back in Nashville for a little bit over 7 years, and in the last 7 years or so, it's given me a really good opportunity to reconnect with Nashville Cares. I was here back in the 1990s as well, but to reconnect, to sort of see where I can be helpful, where we can be useful. We've done some work with My House. And then, of course, we now have a superimposed pandemic on our hands with COVID-19. And that's given me some opportunities to get involved with Nashville Cares around protecting volunteers, protecting employees, protecting patients during this very uncertain period of time.
Yeah, that is great. So you definitely have a lifelong connection to HIV, and thank you so much for choosing Nashville Cares to be involved with as well. So Kelly, I'm going to go to you. How long have you been volunteering with Nashville Cares? And if you want to talk a little bit about some of the volunteering you've done.
Yeah, so I probably got involved. We moved back about 6 years ago. So I started working on and off, mostly in the food bank section. And that kind of led to stuffing envelopes, making phone calls, helping with the gala. And, one of the things I really love about CARES is that they take a holistic approach to health. So our clients don't come in just for medication. They come in for advice on all aspects of their health. And so food is something I'm very passionate about, and making sure that people are taking care of themselves in that respect. And it's so much fun, I have to say, to work. They're busy, before pre-pandemic. Just those, the Wednesdays are just a really great way to connect, meet with people, and just serve the community and meet some incredible people.
Yeah, the holistic approach to clients is, really important to us at CARES. And I think it's also great that we're able to offer a variety of volunteer roles as well. So you've done a bunch of different things, as you said. So I think that's cool that you can help clients directly, but also help staff as well. So that's really cool. Thank you. So I do want to kind of end with a question for both of you. Why do you think it is important for the community to get involved with Nashville Cares?
Well, our community is really affected by HIV. It remains not only a really important public health problem, but we can end it. We can end the epidemic, but it really does require volunteers. This is the kind of thing that really lends itself very well to making a difference. And a lot of people who volunteer, myself and Kelly both, understand that this is a community effort and it's incredibly rewarding. Obviously, the work that Nashville Cares does is very dear to us. And so being an infectious disease expert, it's a natural for me to gravitate towards helping with CARES. But I think it's really a great place for anybody to volunteer. It doesn't require deep expertise in a particular infectious disease or medicine. It really requires caring. And so I think it's a great time as we get closer to trying to end the epidemic for people to step up and work together. And I think CARES provides an incredible opportunity to do just that.
Yeah, I think it's an incredible opportunity to listen and learn, and to center others' voices, and to just show the community that we need to be the change. And for me, it's been an incredible opportunity to set an example for our children that this is just what we do as a community, is we help each other.
Yeah, that's great. I will end by saying that I've noticed that one good thing from the pandemic is that I've been getting a lot more new volunteers who want to volunteer for that very reason, Kelly, because they have realized that they want to give back to their community, affect change. They've taken this year to kind of like look inward, look outward, and realize, okay, I want to be involved. So that's a plus for me, definitely, in getting more people engaged. Yeah, so thank you so much. You two are so awesome. Appreciate having you here virtually, and having you continue volunteering virtually, Kelly. And also, David, thank you for helping us with our COVID-19 response. It's been very, very helpful in making sure that not just our staff and our volunteers, but our clients as well are safe. We can continue to serve them safely. So thank you both. Have a good rest of your day.
Yes, thank you for having us.
Awesome.